Did you know that men who ejaculate 21 times or more a month may reduce their risk of prostate cancer by up to 33%? That's right, something as simple and natural as masturbation could actually be protecting your health. So, why aren't we talking about it more? For years, discussions about masturbation have been clouded by stigma and misinformation, but science is changing that narrative. Regular ejaculation may help flush out harmful substances from the prostate. It can also reduce inflammation and improve overall prostate function. And let's be honest, there are far worse prescriptions than taking a little time for yourself. This doesn't mean you need to follow a strict schedule, but awareness matters. Your health isn't just about hitting the gym or eating kale. It's about understanding how your body works and what keeps it working. So whether you're in a relationship or flying solo, your habits matter. Want to protect your prostate and feel better doing it? Maybe it's time to take your health literally into your own hands. Because when it comes to self-care, nothing is off limits. Even science agrees. Masturbation is a natural and common behavior, yet it remains an often taboo subject, especially when it comes to its potential impact on prostate health. For many men, questions about whether frequent masturbation could harm the prostate, contribute to conditions like prostate cancer, or affect overall sexual health are met with confusion and misinformation. In reality, understanding the relationship between masturbation and prostate health is crucial for debunking myths and providing accurate, evidence-based insights. Recent scientific research suggests that rather than being harmful, regular ejaculation, including through masturbation, may actually have protective benefits for prostate health by reducing the risk of prostate cancer and improving prostate function. By exploring this topic with a focus on facts, we can help reduce stigma and encourage healthier conversations about sexual health and well-being. Frequent masturbation is generally associated with a decreased risk of prostate cancer, according to several studies. One of the most notable is the 2016 study published in European Urology, which found that men who ejaculated 21 or more times per month had a 20% lower risk of developing prostate cancer compared to those who ejaculated less frequently. The proposed mechanism behind this is that regular ejaculation may help flush out potentially harmful substances from the prostate, reducing inflammation and preventing the buildup of prostatic fluid, which could contribute to cancer development. Additionally, regular ejaculation may reduce oxidative stress and help maintain overall prostate health. While further research is needed, the current evidence suggests that moderate masturbation, as part of a healthy lifestyle, does not increase the risk of prostate cancer and may actually provide some protective benefits. Abstaining from ejaculation for extended periods may potentially have negative effects on prostate health, although the research is not entirely conclusive. One concern is that prolonged abstinence can lead to the stagnation of prostatic fluid, which may increase the risk of prostate inflammation or discomfort. The prostate, which produces seminal fluid, relies on regular ejaculation to clear out these fluids and maintain its function. Some studies suggest that infrequent ejaculation may contribute to conditions like benign prostatic hyperplasia (BPH), a common prostate enlargement issue, by causing fluid buildup and increased pressure. Additionally, a lack of ejaculation may hinder the prostate's ability to release potential carcinogens, which could theoretically raise the risk of prostate cancer. While more research is needed, the current evidence suggests that moderate ejaculation may help maintain prostate health, and abstinence from ejaculation over long periods may not be beneficial for prostate function. Frequent ejaculation does not have a direct or significant impact on prostate size. Prostate size is primarily influenced by factors such as age, hormonal levels, and conditions like benign prostatic hyperplasia (BPH). BPH, which causes prostate enlargement, typically occurs as men age and is influenced by testosterone levels and growth factors, not by the frequency of ejaculation. In fact, some studies suggest that regular ejaculation, whether through masturbation or intercourse, might have protective effects on prostate health, potentially reducing the risk of conditions like prostate cancer or prostate inflammation, while ejaculation helps to clear fluids from the prostate, preventing stagnation. It does not appear to affect the size of the prostate in a harmful way. Therefore, frequent ejaculation is not linked to an increase in prostate size and is unlikely to contribute to prostate enlargement. Ejaculation frequency has a minimal and temporary impact on hormonal balance, particularly testosterone levels. Research indicates that while testosterone levels may experience a brief fluctuation after ejaculation, they quickly return to baseline within hours. A commonly discussed study from 2003 found a temporary spike in testosterone levels after a week of abstinence from ejaculation. But this effect was short-lived and did not lead to long-term hormonal changes. Regular ejaculation, including through masturbation, does not result in sustained changes in testosterone levels, and there is no evidence to suggest that frequent ejaculation negatively affects long-term testosterone production. In fact, the body continually produces testosterone, and normal sexual activity, including ejaculation, is unlikely to disrupt hormonal equilibrium. Thus, while temporary shifts in hormone levels may occur post-ejaculation, these do not have a lasting impact on overall hormonal balance or testosterone. In older men, masturbation can offer several benefits for prostate health, although there are some age-related considerations. As men age, the prostate naturally undergoes changes, such as enlargement, benign prostatic hyperplasia, or BPH, and the risk of prostate conditions, including prostate cancer, increases. Regular ejaculation through masturbation or intercourse may help reduce the risk of prostate cancer by flushing out prostatic fluids and reducing the buildup of potentially harmful substances in the prostate. Studies have shown that men who ejaculate more frequently may have a lower risk of developing prostate cancer, particularly those who ejaculate 21 or more times per month. For older men, maintaining regular sexual activity, including masturbation, can also promote circulation and muscle tone in the pelvic area, supporting prostate function and reducing the risk of discomfort associated with BPH. However, older men with certain health conditions such as cardiovascular disease or erectile dysfunction should approach masturbation with caution and consult their healthcare provider if they experience any discomfort or symptoms like pelvic pain. Excessive or forceful masturbation could also lead to issues like pelvic floor strain or irritation. Overall, moderate masturbation is generally beneficial for prostate health in older men, contributing to both physical and mental well-being as long as it is done in a healthy and balanced manner. Regular ejaculation, including through masturbation, may help prevent the buildup of carcinogens or toxins in the prostate. The prostate produces seminal fluid, and regular ejaculation helps clear out prostatic fluid, reducing the risk of fluid stagnation. This stagnation can potentially lead to inflammation or cellular abnormalities, which could increase the risk of prostate problems, including cancer. Some research suggests that frequent ejaculation may help reduce the risk of prostate cancer by flushing out harmful substances and decreasing the likelihood of toxic accumulation in the prostate. Additionally, regular ejaculation is thought to promote overall prostate health by reducing inflammation and maintaining proper function. While more research is needed to fully understand the mechanisms, the evidence points to the idea that regular sexual activity, including masturbation, plays a role in maintaining prostate health and reducing the risk of carcinogen buildup in the gland. There is no significant difference in the impact on the prostate between masturbation and partnered sex when it comes to prostate health. Both activities involve ejaculation, which helps clear prostatic fluid and maintain prostate function. The prostate's role in producing seminal fluid is the same whether the ejaculation occurs through masturbation or intercourse, and the health benefits associated with regular ejaculation, such as potentially reducing the risk of prostate cancer and inflammation, apply to both. However, there are some minor differences that could influence individual experiences. For example, partnered sex may involve physical and emotional components like intimacy and bonding, which can provide psychological and emotional health benefits. On the other hand, masturbation offers a more individualized and controlled experience, with the potential for greater frequency without the need for a partner. Regardless of the method, the key factor for prostate health is the frequency of ejaculation rather than the specific activity through which it occurs. Both masturbation and intercourse, when practiced in moderation, contribute positively to prostate health by supporting fluid clearance and reducing the risk of stagnation-related issues. Excessive or compulsive masturbation can potentially cause pelvic floor strain or prostate discomfort, though this is relatively rare and often linked to the intensity or frequency of the behavior. The pelvic floor muscles, which support the bladder, rectum, and prostate, can become overstressed if subjected to repeated or forceful contractions without adequate rest. This can lead to muscle fatigue, tension, or discomfort in the pelvic area. Additionally, excessive masturbation might contribute to irritation of the prostate, especially if done with excessive force or in an uncomfortable position. In some cases, compulsive masturbation might lead to chronic pelvic pain or a condition called pelvic floor dysfunction, which can cause pain during or after ejaculation. It may also exacerbate conditions like prostatitis, prostate inflammation. However, these effects are generally linked to unhealthy sexual habits rather than masturbation itself. Moderation, a comfortable approach, and listening to one's body are key in preventing any strain or discomfort. If a person experiences consistent pain or discomfort related to masturbation, it is advisable to seek advice from a healthcare provider to address any underlying issues and ensure healthy sexual habits. Urologists and prostate health experts generally recognize masturbation as a normal, healthy, and even beneficial aspect of male sexual health. Scientifically, there is no evidence that masturbation causes any physical harm when practiced in moderation, and it is not associated with negative impacts on testosterone levels, fertility, or prostate function. In fact, several studies suggest that regular ejaculation, including through masturbation, may contribute positively to prostate health. The hypothesized mechanisms include improved clearance of carcinogenic substances in prostatic fluid and reduced intraprostatic pressure. Masturbation also supports sexual function by helping individuals better understand their sexual response, which can be beneficial in managing conditions like erectile dysfunction or premature ejaculation. Moreover, it may reduce stress, promote better sleep, and enhance mood by releasing endorphins and lowering cortisol. However, experts caution that when masturbation becomes compulsive, interfering with daily life, relationships, or psychological well-being, it may signal underlying issues such as anxiety, depression, or behavioral addiction that warrant medical or psychological support. Overall, most urologists endorse masturbation as a safe and beneficial sexual behavior for prostate and general health, provided it is practiced in a balanced and non-disruptive manner. Thanks for sticking around to the end. Now you know the real impact of masturbation on prostate health. The truth, it's all about balance and understanding your body. If you learned something new today, hit that like button. Subscribe for more honest, science-backed health content. If any question, drop them in the comments.